Good day, friends of Buzzy. Although I think it's insane that we are here 1 year later in almost the same place. It's like taking a crap at midnight, same poop, different day at 12:01. So we're going to talk about all of the updates from the things we talked about last year. So we'll talk about updates from nasal irrigation. We'll talk about updates from what medicines work when you're not in the hospital. We'll talk about controversies currently. So we're talking masks, we're talking children, we're talking vaccines and schools. And then I will finish up talking about what the symptoms are if you are vaccinated and you have COVID, and what is not a symptom, so you don't need to worry about getting tested. All right, so let's start with talking about the updates. So starting first with prevention. Multiple studies looked at nasal irrigation, and the interesting thing was many of those studies were done in healthcare workers. What we know now is that in the healthcare environment, if you've been exposed to different coronaviruses, your T cells probably are effective at keeping you from getting it. Now, if you're a researcher, this is a problem because this means that your number of people who are going to get COVID is going to be smaller than you expected, which means that if you want to show a significant difference, you have to enroll a lot more people. So if you want to decrease COVID by half, but the number of people who are getting COVID is only 3%, you actually have to get over 2,000 people in that study. So those studies are finding that indeed no one who's doing nasal irrigation is getting sick or catching COVID, but they're not able to publish until they get a lot more people. So we still know that the countries where they do the most nasal irrigation are Laos and Vietnam. And if you look at the number of cases and the number of fatalities from cases, those and Singapore are still really low. So we've still got that pro-nasal irrigation empiric data. Now in our study, what we found was that of the 79 people we enrolled, one was hospitalized, one had an ED visit, and both of them were in the group that was doing nasal irrigation without betadine. One of the other researchers who I've talked to, they have a longer amount of viral found in the nose, and they were doing, that was in a group that was in soap suds and not in their betadine group. So I personally have backed off, even though there's no statistical support yet. Last night I was in a crowd, so I came home and I did nasal irrigation with betadine. So again, it's going to take a little while because of the numbers to find statistical significance, but the risk is minimal. So I am double vaccinated and have been for months. When I'm in a big crowd, I will use it. So this moves on to what if you get sick? So I talked to someone yesterday who's not yet vaccinated, and I just found out that a friend of mine who is a chiropractor is extraordinarily sick and has gone to the hospital for catching COVID because he didn't get vaccinated. So here's a couple new things that we know about the virus that we didn't know a year ago. First of all, we don't know everything it does yet. The biggest studies that impact me are, there's one that showed a loss of gray matter. So anybody who was hospitalized with COVID had significant MRI proven loss of brain matter. And this is probably why we're seeing in the 50 to 90% range of hospitalization causing PTSD, depression, ongoing loss of sense of smell. This is a nasty, nasty little bug. What it does is, this is also something new we know, what it does is when it enters a cell and again goes into the nose, ACE2 receptors, that's where it starts replicating. So old COVID before the variant took about 6 days to get enough of it that the rest of you would get sick. This one's taking, the Delta variant's taking about 4 days. And when it gets in your nasal passages, it doesn't go into the bloodstream. it starts replicating with these little nanotubules that poke out like little ninja swords, and they just decimate the materials. This is why you get bad headaches. This is why the loss of sense of smell, and this is how they think it's going into the brain, is because it is just able to erode the tissue as it goes through, replicating with these little cells. It's also why it takes so long, and that's the one saving grace, is that this mechanism of replication, of making more of the virus, takes a long time. This is what gives us a window of opportunity. So definitely still sticking with the nasal irrigation, sticking with the betadine, but what do we know about if you catch it, what's going to happen? So the accelerated time frame when you catch it now, what they know is that the way it's getting into your lungs is breathing, and it's like if you go it's if you have a CPAP, if you have obstructive sleep apnea, it actually is more correlated with obstructive sleep apnea that you get very sick than if you're obese. So what's happening is it's breathing the stuff that's replicating in your nose. It's breathing all those little soldiers into your lungs that are a problem. Now, 2 good studies have shown decreased viral load with gargling. So if I think I've been exposed, I would begin also gargling at the same time as doing the nasal irrigation. And there's no reason not to do one or the other or both. But gargling is also something that's been shown to decrease viral load. All right, so that's what we know now. The things we know about treatments. So really, we still don't have great options. For sure, if you are on an immunocompromising IL-1 inhibitor, like a biologic, that is going to be protective. And if you are on methotrexate or prednisone, that's going to be a problem. You actually need to get 3 doses of a vaccine, not 2. Now they're having the vaccine committees are going to talk about it tomorrow, but I'll be shocked if they don't recommend that patients who are on methotrexate or immunocompromised should be getting 3 doses. It seems like it's working pretty well with that. Next thing is, I wouldn't be surprised at all if we add a booster for J&J. J&J is not doing great with the Delta variant, and adding an mRNA vaccine, there's just no reason not to, in my opinion. Now, if you get sick now, so let's say you haven't been vaccinated. So the best research still is a lot of what Paul Merrick at Eastern Virginia Medical Center was doing, which is quercetin, which is a bioflavonoid. It's the antioxidant and antiviral that's found in grape skins and capers and things like that. You kind of have to go to a natural foods place to get it, but 250 milligrams a day of quercetin. Zinc, 75 milligrams if you get sick. Zinc can be hard on the stomach. I would take 25 in the morning and 50 with food right before you go to bed. Melatonin. Melatonin is an antiviral. There was a really good study that looked at an old antidepressant, and the old antidepressant was found to decrease the severity of people who got sick. Well, it turns out, what does it do? It increases your natural melatonin like 100-fold in cells. So at this point, I would just get the melatonin if you get sick, and vitamin C, D. Preventatively, try to take vitamin D to make sure your levels are up. Doesn't help much once you catch it. So try to keep your vitamin D levels up. That's good. All right, now let's talk about controversies and schools and masking. I'm going to go out on a limb here, and I still believe that because you don't have very well-developed sinuses before age 12, I do not think children under age 12 need to mask. And I have not seen enough data that separates out. It's weird. I've been looking for data that separates out kids under 12 versus 12 to 18. Everything we've seen, it's the 12 to 18 are essentially adults, but the younger kids, I can't find it in the Morbidity Mortality Weekly. I can't find it in the AAP data. Everybody's conflating all children. I don't think we should be. I'm absolutely comfortable with not vaccinating anybody under age 6 at this point. Now, I don't think there's any harm to it. I think at this point, all adults are going to catch COVID if you don't get vaccinated. but I think that the chances of someone who's 6 or under catching it is vanishingly small. So the reasons I would get vaccinated are convenience, if you want to travel with the kid, if you've got somebody, and then safety. If you've got somebody who is in the household who's immunocompromised or who can't get a vaccine or who won't, then that would be a reason to not have them bring it home and be asymptomatic. And if they have a chronic health problem or they themselves are on methotrexate, chronic prednisone, if they are obese, then yes, by all means, get a vaccine. But for normal, healthy kids 6 and under, I really agree with a lot of people. I haven't seen data that it's worth the bother. Now, from 6 to 12, and I'm getting some questions, so I'll answer them in a second. From 6 to 12, it's really more of a convenience thing, and they're going to turn past 12 and get full sinuses eventually anyway. So there, in terms of like being required, I honestly feel like this is one where I'm still okay not requiring it. Anybody 12 and up, absolutely, everyone should get it. It should be required, because this is the other part. We don't know what the other shoe is going to drop on this virus later. We know there's myocarditis. We know inflammation of the heart. We know there's scarring and inflammation of the lungs, and we know there's brain damage. So what's going to happen down the road, we still don't know. Measles, for example, 2 out of 100,000 kids who get measles get subacute sclerosing panencephalitis and die 8 years later. That's part of why we vaccinate against measles. So we don't know what's going to happen with the virus. We do know that all we're going to see in the vaccines, we know. Once they're out of your system, there's just not delayed vaccine problems. So, all right, now I'm going to go into some of these questions, and thank you for your time. So the help of betadine in nasal irrigation. Betadine is virucidal in less than a minute. So this is povidone iodine. This is a little small bottle. If you live in Atlanta, I'll give you one. I bought 48 of them. I'm not going to use them all. You only need a half a teaspoon in 250 cc's of nasal irrigation. So if you're using a NeilMed bottle, a cup, 250 cc's, whatever. So NeilMed or a Navage, if you add a half a teaspoon to the salt alkaline mixture that it comes with, that's plenty. It's going to turn it a light brown and could stain your sink. Rinse it off after. But what it's doing is it is a potent vaccine, or a potent viral killer, and it's been studied for about a decade and a half for sinus surgeries and for bacteria. It's been specifically studied for SARS-CoV-2. It's effective. So, Elizabeth, the betadine is to do virus killing, while the fluid is to dilute out and flush out any of the virus. So we like to say the solution to pollution is dilution, and that's why to add betadine. Now, how is that going to work for middle school with some kids that are different ages and some kids haven't gotten vaccinated? I think that my bias is just to vaccinate. If you're in doubt, just go ahead and vaccinate, because there really is almost no harm to vaccinating, and certainly at some point these kids are going to need to get vaccinated. So whether you're doing it now or you do it in 2-3 years, we've handled this so badly that we're going to need to keep getting vaccinated. It's just a matter of how aggressively you are about going to get one, and whether we do any school modifications before people have a chance to get them. So the risks of myocarditis are about 1 in 50,000 from the vaccine, and it's more likely in boys, and it's more likely in teenage boys. We haven't seen it in younger kids. So I think that the risk of getting myocarditis from getting COVID in teenage boys and athletes is about 14%. 14 out of 100 versus 1 out of 50,000. So the risks of the vaccine just numerically are mind-bogglingly negligible. So if you've got kids who are 11 and 12 and some are 12 and 14, then as soon as you can, get those 11, 12-year-olds vaccinated. But it's just a matter of who needs it for themselves to be safe now versus who is it practical for them to get vaccinated now. Again, the mask thing, they just don't have sinuses, you know? I mean, they're not breathing it in the same way, so they're less at risk. So that's part of why I think nobody under 6, and I am pretty fine if the teachers are safe, with 12 and under not, but 12 and up, yeah. So, and you're exactly right, Lisa. If you're talking about how's it safe in a school where kids under 12, well, again, I don't think kids under 12 are going to either get it or spread it much. I mean, the research just doesn't show that. But if you've got worries about the 12 to 14-year-olds, you know, you're vaccinating to protect yourself first and then to protect others second. So let's see, any other questions? Yeah, so if you got a daughter who's 10 and turns 11, so I'm a rebel, and I would talk to my pediatrician and I would say, do you mind? Are you comfortable? Can I sign something that says it's okay for me to vaccinate my 10, 11-year-old? Because the physiologic difference from a vaccine standpoint is non-existent. And again, the risk is so minimal. So I would first ask your pediatrician whether they're willing to vaccinate your 10, 11-year-old. And if not, it looks like probably we're going to see younger kids able to be vaccinated maybe by October. And it's going to be Pfizer first, Moderna second. So I'd go for that. One question I had yesterday was, if you have a choice, which one would you get? And the Moderna has been doing mRNA virus vaccines longer, and there's a little bit better data for the Moderna against Delta than there is for the Pfizer against Delta. So what I told someone yesterday was, if you got the choice to do one or the other, I would go Moderna. If you have to wait a month to get your choice, then take Pfizer now. And I probably would wait a month to get a Pfizer or a Moderna over getting a J&J. So, all right, let's talk about people who are testing positive with the Delta variant. Now, I have had my son and staff members who have been sick over the last couple weeks. I think everyone's heard that we have RSV going around, respiratory syncytial virus, bronchiolitis. We have flu. We've got some croup. We've got a whole bunch. No, we don't have flu. I'm sorry. We don't have that. I misspoke. We have croup and RSV, which are normally winter viruses, which are starting to ease in the south, but they're starting to get worse up north. So how do you tell whether those viruses need to get tested for COVID or not? There is a great website that is collecting COVID symptoms from people who are double vaccinated, single vaccinated, and they're collating the data in real time. This is what we needed at the beginning of COVID. It's beautiful. So what they're finding, interestingly, is if you're fully vaccinated, you've had your second vaccine more than 2 weeks, then the number one symptom of COVID Delta variant is headache. The second most common symptom is runny nose. The third most common symptom is weird. It's sneezing. I don't have a mechanism for that, but interestingly, sneezing is way more common as a COVID symptom than fever. Fever is like number 12. It's way down there. So the top 5: headache, runny nose, sneezing, sore throat, which was actually pretty rare in original COVID, and this kind of supports the go ahead and do gargling with some betadine if you want to. And then the fifth one is loss of sense of smell. So those are the symptoms. Shortness of breath actually is further down the list, and fever is only 12th. So so if you do get the Delta variant, the times you need to be careful, protect, quarantine, and let people know and get tested are if you've got a headache and a runny nose. If you don't have a fever, don't care. That you still need to go get tested for that. All right, let me look at my notes to see if there's anything else. I think that those are all the updates that I can think of. Now, I will spend a little quick bit of plugging How do we help people get vaccinated? One of the amazing things to me is that in Canada, in the Philippines, in India, in lots of places all over the world, they're now doing comfort vaccine locations so that you can get vaccinated in private, so that you can have a staff that understands, that can help you with fainting. So if you're worried about fainting, tensing the stomach muscles has been shown to push blood back up into your brain so that you're not as likely to pass out. So that's an important thing to know for people that are prone to fainting. Again, fainting is not the same thing as fear. There's some overlap, but they're not the same. And we are seeing so many more young people who are getting buzzies to take with them to block the fainting response or to block the fear. I cannot understand why the CDC is not publishing the data on needle fear. This year, or this week, someone told me who had published this big study on adolescents and adults not getting vaccinated, said, well, there was a significant proportion that didn't want to get vaccinated because of needle fear, but until we have the nasal vaccine, we can't do anything about it, so I didn't report it. We can deal with needle fear. One study found that after 3 good experiences, fear was reduced by half and it stays down. So it's just reprogramming from that 5-year-old experience that happened long ago. But this does bring me to one more thing that people are asking about. Needle fear, fainting. Oh, nasal vaccine. Yeah. So a reporter asked me this morning what I thought about nasal vaccines, and they're going to be the deal. They are going to be great. They're absolutely the right thing. It's not the right thing for every rhinovirus or every respiratory virus that goes in your nose. But if you're a parent and you've taken your kid for a rotavirus vaccine, you know that it's oral. And the reason it's oral is because the way the rotavirus enters your system is through the oral alimentary tract. It's through your gut and your stomach and what goes in through your mouth. Well, the way that COVID goes into your body is through your nose. So it's perfectly logical that that's where the vaccine should go. So there are 3 different nasal vaccines that I'm aware of to date. They're in various stages of trials. They're all doing beautifully. They are all very effective. So yeah, as soon as we have the nasal vaccine, that's going to be a game changer, because that will be so easy to take and just squirt up. Should work really well. Very excited about that. All right. If you need any support for your staff to teach them how to give empathy, comfort vaccinations, to do very simple, it doesn't take any extra time. If you're a pharmacy and you want help giving vaccines or understanding how to do it, please reach out to us. We will teach you everything you need to know, how to do it for free. We're very happy to help public health and try to get people vaccinated and stopping dying. This is just ridiculous. So thank you all for watching. Please, if you like our videos, hit subscribe and like. I am intermittently publishing now that we're past phase 1 and 2 and 3, but as needed, I'll keep coming back and letting you know what I think. So thanks so much, and it's going to be fine.